What are the causes, symptoms and treatment of eye inflammation in children and ways to prevent? I was very worried when I noticed my child's eyes swollen. My daughter suffers from pain in her eye with redness and annoying itching, and I don't know how to act. My child woke up and there is swelling in the area around the eye. What caused this? What is the treatment of eye inflammation in children, and how can this pain be reduced from him? It is common for children's eyes to become infected, so it is necessary to know closely what are the types of this inflammation, and what are the reasons behind it. What are the symptoms that characterize each type? How can inflammation of the eye be treated in children? What about the method of prevention and protection from it? Types of eye inflammation in children. There are 3 types of eye inflammation in children: conjunctivitis, and these types differ according to the causative factor and can be distinguished among them through the different symptoms accompanying them and their degree, and this will become clear later. As for the types of inflammation are: viral ocular inflammation, rosacea; bacterial eye infection, red inflammation; allergic eye inflammation. Causes of eye inflammation in children. There are a number of reasons that lead to a child suffering from eye infection, and therefore, by avoiding these factors, it is possible to protect against infection, and these reasons are: 1. Eye exposure to irritants. There are many irritating factors, including particles that can reach the eyes, such as dust, metal filings, sawdust, etc., in addition to inhaling some chemicals or other substances such as cleaning materials, and sometimes the smell of perfume can affect the eyes. 2. Foreign objects get into the eyes. During children's play, many foreign objects can reach their eyes by doing them during their movement or by mistake. Examples of these things are toys and sharp tools, playing with creams and cosmetics and reaching the eyes, or spraying perfume by mistake, or shampooing during the shower. 3. Transmission of the infection to the child. When symptoms appear and during the period of treatment of eye infection in children, it can easily be transmitted from one child to another, from one person to the child, when direct contact with the secretions of the eyes and personal things of the child, and the infection can be transmitted from one eye to another in the child himself, so always each eye is wiped with a dedicated tissue. 4. Lacrimal duct obstruction. The main function of tears is to self-clean, moisturize and protect the eye, so the blockage and congestion of the tear ducts eliminates the most important line of eye defense against itself in the face of the factors that cause eye inflammation in children, and therefore they are vulnerable to them. Symptoms of eye infection in children. Inflammation of the eye in children is accompanied by a set of symptoms, not necessarily all of them, but a number of them are combined, which can be distinguished by distinguishing between them, determining the type of inflammation present, and these symptoms are: 1. Pain in the eye. Eye inflammation in children in the first and second types is usually accompanied by pain that may vary in intensity between mild that the child can tolerate and moderate that turns to annoying, while with viral eye inflammation the pain is not among the usual symptoms. 2. Ocular secretions. Eye secretions are usually associated with eye inflammation in children and are clear in viral and allergic infections, while they turn into purulent and bacterial eye infections, and their quantity varies between mild to moderate and even heavy. You may be interested in causes, symptoms and methods of treatment of persistent tears in the eyes. 3. Feeling itchy. In most cases, itching does not accompany an allergic eye infection, and you notice that your child is rubbing his eye and trying to rub it or feel discomfort in the surrounding area, and it can be overcome by cold compresses. 4. Eye congestion. One of the symptoms that accompanies all types of eye inflammation, usually, and specifically when the cause is a blocked tear duct, or not open in the first place. Normally, the tear ducts open automatically after the birth of the child, but it is also common that this does not happen. 5. Seeing a child. The child's vision is normal in all types and is never affected unless it is affected by other symptoms that accompany inflammation, such as swelling and edema formation, and in general it does not cause any concern. As for those symptoms are as follows, but the step lies in the event that eye inflammation is not treated, when children may lead to ulcers in the cornea that have a significant negative impact on vision and may even lead to blindness. 6. Other symptoms. Inflammation of the eye can be associated with the following symptoms: swelling in the area around the affected eye, eyelids close or sticky, and this is common when waking up, redness of the eye and the skin around it, A rise in temperature. Treating eye infection in children. Always, and the most important thing is to go to the ophthalmologist specialized so that he can determine the condition and at what stage it is, and prescribe the required medication. Only this can guarantee the safe treatment of eye infection in children. As for the following treatments, they are natural and would relieve many symptoms, but with this is necessary to consult a doctor regarding it. 1. Antibiotics. It is given to the child according to a doctor's prescription, and it can be in the form of oral tablets for older children or a syrup for younger children, and it can also be in the form of an ointment to be applied to the area around the eye. 2. Cold or warm compresses. Compresses speed up treatment and relieve symptoms that are bothering your child. Cold compresses. Cold compresses relieve the symptoms of redness of the eyes, the annoying feeling of itching, and they are applied according to the steps. Put an amount of ice in a suitable container with cold water. Submerge a clean piece of cloth in the bowl. Gently apply to and around the eye. Repeat the command. Warm compresses. Warm compresses, in turn, reduce inflammation, swelling and are applied. Heating pure water to a tolerable temperature, get lukewarm water. Submerge a piece of cloth in water. Gently apply it around the eye area. Repeat the command. 3. Green tea compresses. It speeds up the treatment of inflammation, prevents its spread and relieves most symptoms, specifically to help open the eyelids when they are attached. Soak tea bags in lukewarm water. Apply the bags after that on the eyes. Repeat the command. 4. Chamomile tea. Chamomile can be considered an effective anti-inflammatory and treat eye inflammation in children quickly, and chamomile tea is prepared and left until it cools, and then applied as compresses using a clean cloth. 5. Baby comfort and care. Symptoms of eye inflammation may be annoying for the child and need attention as to prevent him from scratching and damaging his eye, and he will naturally need to rest during the treatment period, in addition to the importance of avoiding transmission of infection, all of which makes the child stay at home and his comfort one of the most important things. Prevention of eye infection in children. After treating an eye infection in children, we come to the most important part, which is the prevention of infection, and this is done by making sure of the following points. 1. Ensure that the eye is cleaned with clean water on a regular basis, and specifically when any foreign matter reaches it. 2. Protecting the eye from the causative factors by keeping the child away from it as much as possible, and making sure that all his toys and objects are safe. 3. Avoid contact of the child with infected persons and avoid contact with and use of their objects. 4. Ensuring the cleanliness of the house and the air by renovating it and opening the windows or adopting the designated devices and air conditioners, especially after cleaning the house and spreading dust. 5. Ensure the cleanliness of all the child's personal belongings, from the pillow cover and towel to the clothes, etc. 6. Conduct periodic, regular and comprehensive examinations to ensure the child's health.